Hello there, I'm Marc Price and this is the fourth video in our series of videos for the Sound Daoyin exercise system. If you haven't yet looked at, watched and practiced the first video in this series, I would ask you to stop here now, go back and do that one first and then come back to this one. Any of the others you can do in any order you want, but you must make sure that you've done that first video because it discusses some basic stuff that we have to do for each of these videos, and I don't want to have to keep repeating myself for them. Although I will be giving you a brief summary of those things in each case, just to be on the safe side. Today's sound is called song, but as with the previous one, it's pronounced a little bit differently, not much differently, but a little bit. And the pronunciation sounds like sang when we say it, but I will talk you through in a moment the details of how you actually produce that sound. And therefore, each and every one of us will sound slightly different because it's not really the external sound that we're making that is important, it's the movements and the direction of the sound that we're making. And so because each of us is different, we're going to make a slightly different sound than one another. This sound, so as with all of the sounds in the Sound Daoyin, they work, each one works an individual organ from the traditional Chinese medicine system. This one works the lungs. But also, as with all of the other sounds, as you practice it, after you've practiced it a few times, you'll find that you start to feel a feeling of calm coming over you. You start to become more and more calm and peaceful and relaxed. And that's because, as with all the other sounds, it tends to activate what's known as the parasympathetic nervous system, which in turn deactivates the sympathetic nervous system. So the sympathetic nervous system is a posh way of talking about the part of your nervous system that is the fight or flight response. So when you're in fight or flight response mode, you're going to be pretty stressy. So the parasympathetic nervous system is the opposite side of that. It's much more calm and chilled, which is always a good thing. So, summary of those basics that we see in the first video, your sitting posture and your breathing. I'm going to move back a little bit so that you can see me a little bit better and I can demonstrate the posture. So as you remember, the posture is sat forward in the chair. We've got some of our weight, about 50% of our weight in our feet, the other 50% obviously in the sit bone, and our feet are roughly shoulder width apart, brought backwards so that the tips of the toes are behind the ends of the knees. So if you were to get a plumb line and drop it from your knee, it would touch the floor, not your foot. Yeah? Okay. That then gives you sufficient grip, if you like, into the ground so that you can put a little bit of an upwards force. We want to do that because we want to open up the lower part of the spine. By sitting forwards and taking gravity out of the spine, bringing it into the belly, and then sending an upwards force up through the spine, we're able to stretch it open. So at the core, the foundation of all of the Qigong exercises that I teach, including the Sound Daoyin, we have this idea of stretching, of opening, in particular the spine. The spine is the most important part of that. It's particularly important for the Sound Daoyin because we also have to do some breathing. We have to do internal breathing, which involves also internal movement. That breathing we call reverse abdominal breathing. That means when we breathe in, we pull the belly backwards. We try to make the navel touch the spine. You don't have to make it touch the spine. It probably isn't physically possible, but you've got to try and make that happen. At the same time, we lift the pelvic floor up. So when we're breathing in, we're contracting the abdominal cavity. The diaphragm also comes down when you breathe in. Okay? So at the beginning of each sound, we breathe in using that technique. Now, for this sound, for sang, as it's pronounced, song as it's called, what we do is, first of all, we take an in-breath and we need to shape the mouth correctly in the throat. So to shape the mouth, what you do is you touch the back of your front bottom teeth with the tip of the tongue and relax the tongue at the same time. So as you're breathing in, you've got your tongue just resting gently against the bottom teeth. Okay. And this in-breath then is bringing a force, if you like, up into the back of the throat. So it's kind of like in the back of the tongue area as you breathe in. Then you make the s sound for the sang, that's part of the sang sound, in the usual way, which you may notice as you're doing it is sort of flexing and lifting the tongue up so that it's almost but not quite touching that ridge in the roof of the mouth. S. And then it's ang. Yeah, so it's sang. Breathing in, tip of the tongue on the teeth, sang. So that last bit, that ang, you're raising the back of the tongue into the throat to close the throat off. That's how you make that ang sound, part of the sound. Sang. And then with the rest of the force that you've built up from that in-breath, you're making that vibration as loud as possible and trying to make it travel down the back of the throat, down the tongue and into the centre of the chest. Particularly the thing that you really want to try and vibrate with this is the sternum area. So you can pay attention to that area and notice how well or not it's vibrating from that. So I'm just going to cut for a moment. I'm going to pause here to adjust the lighting, and I'll come back to you in a second.